Hi friends, Brianna here. Welcome back to my YouTube channel. For those of you who do not yet know me, my name is Brianna. I am a nurse doing my thing away from the bedside and in the field of healthcare informatics. In this episode, I want to talk about the Great Resignation, specifically as it relates to nurses. I can't even imagine how frustrating it has been for newer nurses who just have started their careers during this time. Wow. But the Great Resignation has also been called the Great Reshuffle. We're just leaving here and going over there and jumping over here and trying things. Let's talk about jobs I've actually quit. And that sounds so negative. I don't even want to use the word quit or resign, but that's essentially what I did. You know, there's just been a lot of stuff going on, lots of burnout, and folks just really trying to find other alternatives to being fulfilled within their job, within their work career, and then finding that nice work life and fulfillment balance. I will say that my Great Resignation actually started in 2016. I will not count the number of facilities or jobs that I've had since starting, but I will say that I've been in quite a few places. If you do not know what a federally qualified health center is, I'll leave a link in the description of the video or a title card. And an FQHC is kind of set up like a doctor's office. It addresses prevention and primary care, and it really serves the local community and it serves the underserved population. I was a nurse manager who was over a small team of medical assistants, but also worked hand in hand with the medical assistants. So I worked the floor, helped the healthcare providers, helped to room in patients, take vital signs, give vaccination. But I loved the idea around monitoring workflow, getting a feel for what it was like to run a clinic, like what all is involved in helping a patient from the time they enter the facility to the time they exit the facility. Now, why did I leave that job? Well, I left that job because I was a fresh new nurse. I was post-op, so nurses were monitoring patients after they had mastectomies or hysterectomies, DNCs. Sometimes we would get like overflow from the labor and delivery unit, or really just like mother baby, you know, patients that were pretty much stable and didn't require too much since we weren't necessarily trained as mother baby nurses. That was pretty standard. Wasn't really feeling fulfilled. Also, I was on night shift. I hated it. To be honest, I'm not a fan of 12 hours, 3 days a week. I'd rather just do 8 to 5. I like consistency. I like to have my weekends and holidays. Worked as a public health nurse in the infectious diseases department. That was a great experience. The one drawback with public health is that you don't get paid too much, but you definitely get your holidays. You get great benefits. You knew what to expect. There was some autonomy. You oversaw your set of patients, but you still worked together collaboratively with a team. I really enjoyed being there, enjoyed the people that I worked with. Programmatic in nature, where I had to communicate with stakeholders outside of our local health departments. So that could be people at the state level or community stakeholders, people in hospital systems or at schools, lending some knowledge base around testing and screening and tracking. I left that job because I was traveling several places, but due to other personal reasons, I couldn't continue to travel the way that the job was expecting me to or had really demanded. I've been taking opportunity of different contracts. So not necessarily travel nursing, but more so contract nursing. Whether it's because of the money, whether it's because of the sense of fulfillment that you get, whether it's because of the experience that you get that's going to take you wherever your long-term goal is, just don't give up on the degree altogether, because that degree virtually can translate into so many things. So I just wanted to make this video to encourage those who were thinking about leaving the profession altogether to not do it so early. You know, things are going to be hard. A lot of stuff is going to suck, and probably for a long time. It definitely gets better, and you know, make it work for you. Do what you got to do until you can make it work for you. So I hope that was something, a little bit of something. I hope that this video was helpful in some form or fashion. That is my opinion on the Great Resignation as it relates to nurses. That's it, guys. I will see you on the next episode. Bye.